In a month's time, New Zealanders go to the polls and leaders of both major parties, Labour and National, have been campaigning. But meanwhile, a Pacific Health professor says both Labour and National's plans to address the chronic health worker shortage doesn't go far enough. Both parties have pledged to increase the workforce if elected. An extra 95 doctors under Labour and 50 under National. Auckland University Medical School Pacific Associate Dean Collin Tukuitonga told Lydia Lewis the plans only make a small dent in a gaping hole.
Both announcements are welcomed. I think the country has been crying out for some years now with regard to the shortage of doctors and nurses, and so these are very good announcements. I should say that, in fact, Labour announced 50 new additional places as of 2024. 30 of which will come to us in Auckland and 20 to Otago. We've prioritised Māori, Pacific and rural students. And the addition, and the 95 you mentioned, I think goes on for 3 years. And so it's a significant increase. I don't know what the allocation from National is like in terms of the distribution, but concerned, of course, that the ACT party, if they're in coalition with the National Party, has signalled their intention to do away with affirmative action policies like what we have at MAPIS in Auckland. So the announcements are to be welcomed. Clearly the details are different. I think the Labour announcement is a continuation of what they've signalled already.
What exactly is ACT going to do away with, and what impact will that have?
Well, ACT has signalled their intention to do away with the ethnic-based program. My understanding is that ACT is against any ethnic-based affirmative action type activities. We're yet to see, of course, how that will pan out. But if that were to happen, it is a concern from my point of view, because obviously we need affirmative actions to try to remedy the chronic inequities and shortage of Māori and Pacific health professionals in New Zealand.
Of the announcements from both Labour and National, do they go far enough to address those needs?
Oh, no, they don't. I mean, the Pacific share of the 15,000 medical workforce in New Zealand is less than 2%, so this will lift it, no question. But if you think about the share of the population, the Pacific proportion of the workforce, if it was to address the diversity in our population, should be 10%, and we're still only at 2%. But as I say, it is a step forwards, but we're a long way away from what's equitable and what's needed in terms of the population share.
What could National or Labour do to further address those issues?
The announcement was specifically around workforce, and it is one of the critical issues for our health system. In terms of the broader health policies, I'm not aware of any. There's some concern in the health media about National wanting to reduce health funding to frontline services. People are always concerned, of course, about the market-orientated ideology that the National Party tend to have in privatising health care. And so I guess there will be those ongoing concerns. I'm not aware of any of Labour's broader announcements with regard to health and funding for healthcare providers.
What would you like to know? What information is lacking from both parties?
The community and healthcare providers would want to know what parties intend to do, particularly in relation to primary care, access to GP services and other services. That's the fundamental issue. People are concerned that they're having trouble getting access to GPs. Shortage of GPs means clinics are closing their books. So that's a primary concern. What do the parties plan to do with regard to access to primary care? Mental health and well-being is a chronic concern. I understand that Labour's announcements include additional places for psychiatry training. I am not aware of any other announcements from the National Party with regard to access to care. I think the fact that senior doctors have gone on strike tells me that our health system is indeed under severe strain, and I would like to see political parties, make statements about how they intend to relieve the pressure on doctors and access to health care, and generally increasing investment in our health system, which appears to be struggling.
How would you sum up the action or lack of action on this issue from both sides so far?
Well, clearly something needs to happen. I would like to see a direct response from political parties in relation to the senior doctors on strike. I'm aware that there will still be policies that are perhaps yet to be announced, but I'd like to see a direct response from the political parties with regard to how they intend to address the concerns shown by the senior doctors. This is a significant development in healthcare in New Zealand. I'm not aware of senior doctors going on strike ever. And so there needs to be a response. What do the political parties intend to do to relieve the pressure on senior doctors, relieve pressure on emergency departments, improve access and funding for primary care, and address the chronic strain that health professionals are under?